This is a $2 trillion part of our economy. And it is my belief that not just politically, but also economically, it's better for us to start getting a system in place, a universal health care system, signed into law by the end of my first term as president, and build off that system to further, to make it more rational. By the way, Canada did not start off immediately with a single-payer system. They had a similar transition step.
It's a transitional system building on the existing systems that we have.
Transitional to what?
Well, transitional hopefully because the system currently is such a patchwork of inefficiency that over time I would want to see Medicaid, Medicare, the Children's Health Insurance Program, SCHIP, all those integrated more effectively.
Let's say that I proposed a plan that moved to a single-payer system. Let's say Medicare Plus. Essentially, everybody can buy into Medicare, for example. Transitioning a system is a very difficult and costly and lengthy enterprise. It's not like you can turn on a switch and you go from one system to another. So it's possible that up front you would need not just, I mean, you might need an additional $90 or $100 billion a year.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
There's no denying that part of the solution in the healthcare arena, as we transition and deal with the legacy systems that we've inherited, will probably require some additional money.
The public option is not your enemy, it is your friend, I believe. Let me also address an illegitimate concern that's being put forward by those who are claiming that a public option is somehow a Trojan horse for a single-payer system.
My commitment is to make sure that we've got universal health care for all Americans by the end of my first term as president. I would hope that we set up a system that allows those who can't go through their employer to access a federal system or a state pool of some sort. But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
I happen to be a proponent of a single-payer universal health care plan. A single-payer health care plan, universal health care plan. That's what I'd like to see.
I think if we get a good public option, it could lead to single payer, and that's the best way to reach single payer.
And next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete. That a public option will put the private insurance industry out of business and leave single payer. My single payer friends, he was right. The man was right.
Nobody is talking about some government takeover of health care.
At the federal level, what I'm looking at is a very specific proposal that would provide health care coverage for all children who need it all across the United States, would allow 55 to 64-year-olds to buy into the Medicare system. And I think that if we can start with children and those persons 55 to 64 that are most vulnerable, then we can start filling in those holes and ultimately, I think, move in the direction of a universal health care plan.
A single-payer health care plan, universal health care plan. That's what I'd like to see.
Finally, let me discuss an issue that is a great concern to me, to members of this chamber, and to the public. And that's how we pay for this plan. Now, here's what you need to know. First, I will not sign a plan that adds one dime to our deficits. either now or in the future. Second, we've estimated that most of this plan can be paid for by finding savings within the existing healthcare system.
Estimates range from 20% to 30% of our healthcare dollars go into red tape, paperwork, profits for the private marketplace, and so forth. Conceivably, it is possible to capture those savings and apply them to provide coverage, in theory. But transitioning a system is a very difficult and costly and lengthy enterprise. It's not like you can turn on a switch and you go from one system to another. So it's possible that up front you would need not just, you might need an additional $90 or $100 billion a year to provide coverage, with the understanding that you would capture savings over the long term as the system transitioned. And the question then becomes, how do people feel about paying additional money? Let's say that I proposed a plan that moved to a single payer system. Let's say Medicare Plus. Essentially, everybody can buy into Medicare, for example. It would cost a huge amount of money. We're going to have to come up with at least $15 billion in new money just to maintain the existing coverage that's provided to kids through the S-CHIP program. There are an additional 6 million, I believe, children who are not covered, but who would otherwise be eligible. So we'd have to come up with some additional money to cover them, to make sure that every child has basic coverage. And I think it raises then the issue of cost. And that's why there have been a couple times where I've pushed people on the idea of paying higher taxes in order to implement the system. And by the way, that's an area where we should be willing to make an investment up front, because there may be community hospitals in rural areas, for example, that can't afford to set up the computerization and the software system. The federal government should subsidize that initial process.
Being a healthcare provider, I see that Medicare, Medicaid pays 62 cents on the dollar.
You're right that Medicare and Medicaid, oftentimes politicians use those two systems as a way of, as a sort of a safety valve in the budget, particularly at the state level. So what they do is, if they get in a budget crunch, they will delay payments to doctors, or the reimbursements won't be quite as high, and force providers to suck up the costs. Then one of the things that I want to find out is whether folks are actually ready to move off an employer-based system.
I will not vote for a bill. I don't have a vote, but I would not vote for a bill that does not have a public option in it, period, plain and simple.
Well, that's what Bernie Sanders says as well. So
yeah, he's doing the right thing, and I'm hoping there's going to be 4 or 5 other senators that'll join him, and that'll be... Look, there is something worse than passing no bill. This bill isn't very strong. In fact, the only piece of reform left in it is the public option. The insurance reform is gone, essentially, because what they did was they have guaranteed issue. That is, you have to, the insurance company has to insure you. The problem is they don't have community rating anymore. They in the Senate bill, I think you can charge 3 or 4 times as much as for sick people as you do for healthy people. In the House bill, it's twice as much. You know, we did this 15 years ago in Vermont, and you can charge 20% more for your most expensive clients than you can for your cheapest clients, and that's it. Now, you can afford to buy health insurance if it's only 20% above the bottom price, but you can't afford to buy health insurance if it's twice as much or 3 times as much. So guaranteed issue doesn't do you any good unless you have real community rating, and real community rating doesn't exist in either the House or the Senate bill. So the old argument, which I used to make, was that we ought to pass this thing just to get the insurance reform. There isn't any insurance reform left in this bill to speak of. You know, what this is a giant bailout. This is a bailout that makes AIG look cheap. $60 billion a year goes to the insurance companies under this bill. Now, if we can get a public option, I think that's okay. But if you don't have a public option, why would we want to stick the taxpayers with yet another bailout? They bailed out the banks. They bailed out AIG. This is a $1 trillion bailout. I would vote with Bernie Sanders. I would vote to kill this bill if it does not have a public option, because that is doing harm to the nation. It's not just, well, there's going to be some of this. This is a harmful bill to the nation without a public option, because it's going to take trillions of dollars, trillions over several decades from our kids. The Republicans are right about the rhetoric of the bill, but if you get reform, you can fix it. If you don't get reform, you've got a system that we have today. You're gradually going to start uninsuring people because we're not going to have the money to maintain the system. It does nothing to control costs.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
I happen to be a proponent of a single-payer universal health care plan. A single-payer health care plan, universal health care plan. That's what I'd like to see.
I think if we get a good public option, it could lead to single payer, and that's the best way to reach single payer.
And next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and my single-payer friends, he was right. The man was right.
Nobody is talking about some government takeover of health care.